Good morning. My name is Thea Garon, and I'm thrilled to be here with you this morning, sharing results from the 2020 U.S. Financial Health Pulse. Now in its third year, the Pulse draws upon survey data, and for the very first time this year, transactional data, to provide insights about how the financial health of people in America is changing over time. This year, in the midst of the unfolding COVID-19 pandemic, the Pulse provides a particularly valuable contribution to our understanding of how different groups of people in America are faring financially in the midst of rapidly changing economic circumstances. And what we found in the data this year initially surprised us. In the aggregate, financial health has actually improved since last year. Using the FinHealth Score measurement methodology, we found that as of August 2020, more people were financially healthy than in 2019. But as we dug deeper, we began to understand why. It appears that a confluence of one-time policies and interventions and events has cushioned the blow of the economic impact of the COVID-19 crisis for many people. The stimulus payments, the additional $600 in federal unemployment insurance, loans from the Paycheck Protection Program, and other stimulus measures provided a valuable lifeline to millions of people over the summer. Debt relief programs, loan deferrals, and eviction moratoriums also eased the financial strain of millions of households during the early months of the pandemic. At the same time, state-mandated economic closures forced consumers to reduce their spending, and many people have continued to keep their expenses low even as economies have reopened. But because the improvements in financial health we observe at the national level appear to be driven by these one-time interventions and events, there is reason to believe that these positive trends may prove to be short-lived. And despite these positive improvements, more than 2/3 of people in America are not financially healthy. And millions of people are experiencing extreme financial hardship as they struggle to put food on the table and keep a roof over their heads. We also found that profound disparities in financial health have persisted across race, income, and gender over the past year. In some cases, these disparities appear to be widening. Collectively, these findings highlight the need for both short-term policies that provide people with immediate financial relief to weather the ongoing effects of the pandemic, as well as long-term solutions that dismantle systemic barriers to financial health and improve financial health for all. Now, before I explore each of these findings in more depth, I'd like to first thank our funders, Flourish, MetLife Foundation, and AARP, without whom this research would not be possible. I'd also like to thank our research partners, USC's Center for Economic and Social Research, as well as Plaid, for their ongoing collaboration on this initiative. The 2020 results that we'll explore in just a moment are based on a combination of survey data, and for the very first time in a Pulse Trends report, transactional data that study participants have agreed to share with us. The survey data come from surveys fielded to the University of Southern California's nationally representative online consumer panel. Most of the survey data that we feature in this year's 2020 Trends Report comes from a survey fielded from July 27th to August 9th of this year that approximately 6,400 people responded to. The transactional data that we feature in the Trends Report were also collected from members of USC's panel who agreed to link their financial accounts to a platform that we designed with our partners at USC and Plaid. As of July 31st, more than 800 members of USC's panel had linked at least one account to the platform, with the most commonly linked accounts being checking accounts, savings accounts, and credit cards. The demographic composition of the participating transactional data sample broadly aligns with the demographic composition of the banked population of the United States, skewing slightly higher income, younger, and more educated. And while the insights based on this data set are not fully nationally representative, they can be considered illustrative of trends at the national level. We also use the FinHealth score measurement methodology to assess financial health throughout the 2020 Trends Report. So for every survey respondent who answers 8 survey questions that align with the 8 indicators of financial health, we can calculate one FinHealth score on a scale from 0 to 100 that we use to categorize respondents into one of 3 financial health tiers. Using this framework, we find that as of August 2020, 17% of people in America were financially vulnerable. These individuals are struggling with all or nearly all aspects of their financial lives. Half, or 50% of people in America, are financially coping. These individuals are struggling with some, but not necessarily all, aspects of their financial lives. Just 33% of people in America are financially healthy. These individuals are spending, saving, borrowing, and planning in ways that allow them to be resilient and pursue opportunities over time. These figures represent an overall improvement in financial health from the prior 2 years, when 29% of people were considered financially healthy in 2019, and 28% were considered financially healthy in 2018. And as we explore in depth throughout the 2020 Trends Report, the improvements we see here in financial health at the national level are the result of improvements across nearly all of the 8 indicators of financial health. For example, considering just one of these indicators, Indicator 1, spending less than income, sheds light on how people's financial situations have changed within the context of the evolving COVID-19 pandemic. This graph here shows inflows to liquid accounts in the Pulse transactional dataset compared to outflows from liquid accounts from the beginning of this year until August of this year. The first line on the graph shows total median inflows to liquid accounts, including checking accounts, savings accounts, prepaid cards, and money market accounts. And the second line on the graph shows total median outflows from these very same liquid accounts. And looking at this graph, we can see that for much of the study period, total inflows remain significantly higher than total outflows from liquid accounts, aligning with people's self-reported perceptions that their spending was generally less than their income in 2020. When we analyze the data further, we can also see the role that some of the pandemic-related stimulus and relief measures have played in contributing to these trends. For example, we find that the spike in inflows in April appears to be related to the receipt of stimulus payments, the first of which were distributed via direct deposit on April 13th. We know this because when we remove stimulus payments from account inflows, which we're able to identify using Plaid's categorization API, we see that the spike in inflows in April largely disappears. We also see that the spike in inflows in March can primarily be attributed to the receipt of tax refunds. When we remove tax refunds from account inflows, we see that the spike in inflows in March shrinks considerably as well. But despite positive financial health trends at the national level, we also find that millions of people are still struggling to make ends meet. Since only 33% of people in America are financially healthy, that leaves more than 2/3 of the country, or approximately 167 million people, who are either financially coping or financially vulnerable. And many of these individuals have been experiencing severe financial hardship over the last few months. 22% of people who are considered financially coping or financially vulnerable said they worried their food would run out over the past 3 months, while 26% said they worried about being able to afford their rent or mortgage. In order to cope with the ongoing effects of the pandemic, 41% of people in these tiers said they carried a balance on their credit cards, while 29% said they spent down their savings in order to make ends meet. We also find that profound disparities in financial health have persisted across race, income, and gender. And in some cases, these disparities appear to be widening. Looking first at race and ethnicity, we find that as of August 2020, only 15% of Black people and 24% of Latinx people were considered financially healthy, compared with 39% of white people. And these disparities appear to be increasing over the past few years. We also find disparities in financial health have persisted across income segments. As of August 2020, we find that people with higher household incomes were significantly more likely to be financially healthy than those with lower incomes. Looking across all 3 years of survey data shows us that these disparities appear to be widening as well. And while income no doubt plays a role in financial health, it should not fully determine one's financial health. So these growing disparities are cause for concern. And finally, we find that profound disparities in financial health have persisted across gender. While women were actually more likely than men to see their financial health improve since 2019, women remain far less likely to be financially healthy than men overall. As of August 2020, slightly more than a quarter of women, or 28% of women, were financially healthy, compared with 40% of men. In the 2020 Trends Report, we explore some of the many factors that are contributing to these growing financial health disparities across race, income, and gender. We also explore trends across each of the 8 financial health indicators in more depth, and we conclude our analysis by calling for short-term measures that provide people with immediate relief to help them cope during the ongoing pandemic, as well as long-term solutions that dismantle systemic barriers to financial health and promote financial health for all. So with that, let me conclude my remarks, because I know the panelists on the next panel are eager to reflect on some of these findings and discuss some of these very solutions. In parting, I'd like to leave you with a few ways that you can engage with these pulse data further. You can download the 2020 Trends Report via the link on your screen to explore the wealth of data included in the report, which I've just barely touched upon this morning. You can join a webinar where we explore each of these trends in more depth. You can find the link to register for the webinar below this video under related content. And you can download the full pulse survey instrument and the complete data set from the 2020 surveys, as well as from prior year surveys, via the link on your screen. Finally, please feel free to reach out to me directly to explore how your company or organization can leverage the pulse data set to understand and improve people's financial health. Thank you.